Hello dear students, watch this video till the end to take a informed decision whether to opt for dermatology or whether to take any other branch. You are going to get a clear cut idea if you watch this video till the end. So welcome dear students, myself Dr. Maddineni Srinivas, your dermatology faculty in this wonderful Cerebellum Academy. So since I have done my diploma and also DNB, so I am having a clear cut idea how both of these are going to work, and I will try to give my own views regarding both these in this particular video. So watch this till the end. And you can also ask any queries related to the dermatology branch or anything related to dermatology. You can see the scanner code is there. Just scan it and join my groups. And yes, one more thing which I want to tell you, I have done dermatology, so I can give you a clear cut picture regarding dermatology, everything related to it. But I will be just a spectator for the other subjects, so I cannot give you the first hand knowledge information regarding other subjects. So please try to ask the concerned subject specialty faculties only related to other subjects. Okay. And this video I will try to explain you regarding the dermatology as a specialty, what you have to expect from dermatology and what dermatology is going to expect from you, and also share my perspective and experiences during my diploma and DNB. And ultimately the selection of the branch is your choice. So listen to this video and try to take the informed decision after understanding of whatever I have explained. And most important, my this thing to make this video is to prevent the unnecessary wastage of the dermatology seat, very precious seat. I have seen myself, one of the students took the DNB dermatology and then left it, and then later on joined the radiology. So are you interested in dermatology or you don't want to take dermatology? So in this video I will try to make it clear what is going to be in the field of dermatology which you can expect, so that you will have some knowledge at least about the branch. And yeah, there are also other techniques I will show you in the upcoming slides, how you can select or reject a branch. And some doubts regarding branch saturation, I will try to address those doubts. And also some students have this quackery is there, sir, so many saloons are there, sir, why should we take dermatology, sir? So I will try to explain that also, and colleges list I will put it at the end. So yeah, you have done all the hard work and you are busy preparing. Now the step number 1 is completed, that you got a great rank. Step number 2 is also very important, the counseling part, the selection of the colleges, selection of the branch, selection of the state, everything is very important. So I will try to give my perspective regarding the second step which you need to take now. And this is a lifelong companion, the branch you cannot change it. So it is like an invisible life partner, so that you have to take a clear cut informed decision. Remember this dialogue, I like it a lot. नज़दीकी फ़ायदा देखने से पहले दूर का नुकसान सोचना चाहिए. Very important. So this is the trick Dr. Praveen Tripathi sir has given. So you can read it and you can pause it and read it. And if you like it, you can follow it. I feel this is very helpful. You can, this is like a trick which you can follow to get to know about the branch. And like I have told you, this is an invisible life partner with whom you are going to have the journey. So this journey may be like this scenario number 1, where it is going to be very happy relationship between you and the branch, or if you don't have a proper knowledge, the relationship might also be look something like this. I hope you might have seen this movie where the ghost will be sitting on the shoulders of this person. So don't make the subject like this ghost, okay? Let it be a good companion for you till the last breath. Remember, you cannot change the branch, that is very important. So you have to take a proper informed decision. And yeah, you have all got the awesome rank. First of all, hearty congratulations. You are thinking of taking dermatology or radiology, maybe you are confused between these two, that is even more great thing. But taking a great decision, good decision is very important, very crucial. So I'm going to help you with that. And also, what could be the reason for this confusion is, the first thing is, maybe in your MBBS times the dermatology was not a proper, well equipped branch in your particular college, or maybe in the internship you are not having the rotations in the dermatology, or you have probably skipped it to prepare for the NEET or INS 80. So whatever may be the reason, so you have skipped that, you are not having a proper idea. I will give you some of my perspectives, and if you are doing the MBBS right now, my suggestion is going to be, don't skip the postings, do go attend all the postings, so that you are going to get proper idea. Getting an idea about what branch not to take is also very important. Okay, at least if you get that idea, that is also a great thing in your clinical postings. And these are some of the doubts which students always keep asking. Okay, they are neutral about this subject, neutral about that subject, what should I do? So these are the all the queries which students were having. Okay, during your preparation, study with the intention to help your future patients. If you have this intention, then that would make your success more necessary than just a matter of luck. And phase 1, that is hard work has been done. I hope you have watched this movie Life of Pi, in which he gets into a boat and stranded in the sea. He's on a journey where he does not know where he's going, where to go, okay, how he's going. So but you have completed this particular journey. Step number 1, that is, you have got a great rank. All the very best. Awesome, heartiest congratulations from my side. So you are in this phase now. So in this movie, actually the hero is going to reach land finally, and there will be people coming and saving him, joining him in the hospital. Right now you are in this situation, you have done hard work, you are now awaiting the counseling, like this patient, okay, this hero lying on the bed and just relaxing, waiting for the counseling. Okay, or the next second scenario, maybe you are MBBS student who is just watching this video to understand how the dermatology is. So whoever this is watching, okay, it is going to help you a lot. This is a flow chart which might help you to select the branch of your choice. Where does dermatology fall here? So if you observe carefully, the dermatology is present here. So if your grades are great in your MBBS time, if you are very studious type, and if you don't like surgical branches much, and if you are socially inclined, you like the patient interaction, okay, then if you are interested in the rashes, think of dermatology subject. Okay, rest of the other subjects also you can choose accordingly, which you fall under. But ultimately, remember students, whatever I say, whatever other videos will say, ultimately the feeling has to come within, from within. Okay, that I have to take dermatology, I am a dermatologist, I can live with this dermatology till my last breath. Okay, अंदर से आवाज आनी चाहिए. Whatever anyone says, don't bother about all those things. So don't go for what the relatives want you to become, what your parents want you to become. Always listen to your heart and brain, and if both of them are aligned, then that is the subject which you have to take. And there may be some students, मेरे से नहीं हो पाएगा. You have given the entrance examinations and you are frustrated. You do not want any more exams. You don't want to give a DM, MCH, any other exam, super specialty and all. This dermatology is a end branch. We can say technically, officially also it is an end branch. Yes, definitely there are some subspecialties coming up right now: aesthetic dermatology, cosmetic dermatology, hair transplantation, lasers. Okay, but still technically this dermatology is an end branch. So if you have joined this, that's all. If you have the degree of MD DNB dermatology, your life is sorted. There is no need for any other entrance examination at least. And yeah, your views may be different from my views. Okay, so you may think that, oh, sir, I like some super specialty. This should not be a end. There should be more learning in the future. So you can as well opt for other subjects in which the super specialties are available. So coming to the dermatology proper, the first thing which is different from radiology, so I'm just giving you some pointers why this dermatology is different from other subjects. Okay, from radiology this is different, so both are compared between each other. With from many students I have seen the messages, sir, radiology or dermatology. So in the dermatology, the great point is the patient interaction. You have a chance to talk to the patient, ask the history, take proper past history, everything, family history. You can talk to them, you can give the treatment, you can manage the patient, you can follow up the patients. Okay, in radiology this is what is lacking. Okay, you are just like a technician, okay, doing some scan, okay, ultrasound scan, reading some CT scan report and giving a report. Okay, this interaction is what is missing. Okay, uh, that is the difference between radiology and dermatology. And yeah, definitely with the words you can give the comfort to the patient, and you can give so much of relief for the entire family also, not only just the patient. And your words and the counseling might be very very helpful, and they form the key part of the management of a particular patient. Okay, and yes, like cerebellum get the balance right, the work life balance in dermatology is also beautiful. So you can you know see the patients, you can earn the money. Of course everyone is doing what they are doing for the money, vitamin M, so you can get that money also. And also you can have a good life for yourself. Okay, it's not that you are keeping on working like a donkey for the purpose of the money. You can have timings, strict timings, like morning 9 to 5, afterwards I will give the time for my family. Whereas in other branches this might be a problem, okay. So that's why I told you नज़दीकी फ़ायदा देखने से पहले दूर का नुकसान सोचना चाहिए. So many students they feel that they want money, they want more money, so they will go into branches which are very very hectic. So I will discuss what is the problem with that. So in dermatology, like I have told you, it is going to be some 8 hours of a shift, even after the PG also. But in the PG, what is there now at present, there might be some night duties also, where 14 hours maximum might be the work which you might be expected to do, and once a week you might be on call also, depending upon the institute, and free time is going to be left later on. Okay, but don't think that there is a lot of free time what we can do. So remember, dermatology there is so much to learn, so there will be so much of academics in which you have to participate. There will be case presentations and journals, and there will be academic where powerpoints should be made, and you should teach probably some of the latest topics, theory based topics, which are not usually seen in the OPT. So there is so much of it which we'll see in the later on slides. And yes, you might be having some passion, like hobbies, to go to swimming, to learn music, or to learn some music instrument, so whatever it is. And also if you are married and if you are having children, maybe family time is also very important. So all these things can be greatly well aligned with the dermatology subject, whereas in other subjects this is a problem. So other branches which are mostly clinical, there might be work hours like 24 to 36 hours of non-stop duties might be there, where it will be very difficult for the individual to cope up with the family and also the work. And not only during the PG time, this 24 to 36 hours work life may be also there after the PG is completed, also in the specialties, like for example gynecology, surgery, where there can be any patient who is coming for emergency surgery. So you cannot tell that okay, I will come tomorrow morning. You have to attend that patient. So this is the difference between the dermatology and other subjects. And like I've told you, emergency, so stress might be associated, and you have to have that adrenaline rush. Okay, so dermatological emergencies are also there. So there are some drug reactions, you might have read them, SGS and TN, and histamine related angioedema, which could be a life threatening condition, and also skin failure, the vesicular bullous pemphigus, pemphigus foliaceus vulgaris, bullous pemphigus, all these things might present as dermatological emergencies, but very less when compared to the vast dermatology, which is non-emergency. But other branches, like I have told you, they are going to have the core emergency situations like acute MI, the patient is in seizures, paralysis. So you have to be on your toes for those particular subjects. And these are all the dermatological emergencies, like I have told you, the vesicular bullous disorders, SGS and TN, and angioedema. Okay. Yes, if you love the adrenaline, if you want that adrenaline in your veins, then you can probably take even emergency medicine. That is also a great branch where you can be completely taking care of the the casualty in the corporate setup, or you can also take care of whatever emergencies do come in a particular hospital corporate setup, or your own setup. Maybe you can make. And if you think that dermatology is just a branch where there is only topical creams, only acne is happening, you are absolutely wrong, because of late so much of development advancements are occurring in dermatology. And I probably you might have read the vesicular bullous disorders, papilloscomus disorder, the systemic drugs which are available, the monoclonal antibodies, and also skin is not the only thing which dermatologist is going to treat. Dermatologist is a dermatologist, venereologist, and leprologist. So STDs are also there, and also leprosy is also there. So all these are going to be taken care of by dermatologists. It's not just creams, acne, okay, some steroid cream. There's a lot which is happening in dermatology. Of course, with the advent of the aesthetics, lasers, it is even being proposed that this aesthetic dermatology should become a super specialty. So it is not right now, but maybe in the future, who knows, it might be a super specialty also. So sky is the limit for the practice and also for the money related to dermatology. It's not just the core dermatology of seeing the patients, even there are so many other things which are coming up. And I personally love my job because results might not be instant, like for example in a patient of acute MI, if we give some medication, the pain may reduce, okay, but in dermatology that might not be happening, because the lesion which is seen over the skin, it is yes clinically visible in front of the eyes, the diagnosis is there, we will give the treatment, but it will take some time. Skin disease are usually chronic, so it might take some time, but yes, definitely if the patient is responding nicely, then the improvement is going to be very good, and the patient is going to be very happy, and that is also going to satisfy the dermatologist also. And one more thing, the core dermatology or clinical dermatology, in that patient is going to have some symptoms in the skin, okay. Whereas in aesthetic dermatology, what do you mean by aesthetic? So if a person is there, like for example, everything is normal, there is no symptom in that person, but they have this problem that they feel that the skin is saggy, so they want beautification of themselves, okay. They don't have any symptom, any disease, beautification purposes. If any person is coming, the better term which we can use for them is we can call them as clients, okay. With the clients who are our aesthetic dermatology related patients, okay, they are clients, not patients, they might be having dissatisfaction with the treatment which you are giving. We might give botox, fillers, threads, okay, there are so many treatments, lasers, but whatever we may do, the client may not feel happy, whereas patient is going to feel very happy with the improvement in the symptomatology clinically, which was bothering that patient. This is one more difference which you need to remember between core dermatology and aesthetic dermatology. And you can see these are some of the reviews which patients have given, okay. They can be so much rude related to aesthetic dermatology that they have given these remarks on the doctor who is having so much of experience, okay. Whatever it is, aesthetic dermatology patients, usually the clients, they usually do not have so much of satisfaction even with how much ever treatment we are going to give. And like I have told you till now, dermatology is not just confined to the medications, capsules, creams. Okay, it is a mixture, it is a spectrum of both the medical management and also the surgical management. Okay, there is so much happening in the surgical side of the dermatology also. And like I have told you, the diagnosis is going to be in front of our eyes, it will be present on the skin. So treatment is also going to be in that grounds only. So the dermatology is going to range from acne, which is a very small minor thing, to life threatening conditions. And one more problem with dermatology is that the problem is in front of your eyes. But remember students, what are the eyes going to see? What the brain knows. Okay, so the famous quote which you have to remember is, the eyes may look, okay, you may look at anything, but you can only see if your brain knows that. So you have to read a lot. So there is so much to read in dermatology also. The books are very bulkier, just like Harrison, or even more bulkier than Harrison. So be prepared for all that learning. And also there can be some integration with other subjects also, like for example, if a patient of SLE or scleroderma, dermatomyositis comes, then rheumatology and dermatology integration is required. And like for example, in certain conditions, dermatopathology might also help us, so we need to have some detective like work. And of course, with the dermatosurgery, there is a surgical touch to the dermatology subject. And one more important point which I want all my students to know is that there are fellowships and observerships which you can join, and with the help of which you can improve your knowledge in dermatology after your PG. So this RGUHS, Rajiv Gandhi University of the Health Sciences, RGUHS, it has in various colleges some fellowships which are available, like for example dermatosurgery, aesthetic dermatology, pediatric dermatology. So once you complete your MD DNB, you can, or diploma also, you can join these fellowships and you can get the additional degree which you can gain. And if you get a opportunity to do the MD or dermatology in these particular institutes, then it is even more great. St. John's, Bangalore Medical College. Okay, so in these, if there is a MD DNB, better choice to opt. Okay, cuties. So some of them do not have the MD DNB courses. Kempegoda, KIMS. Okay, so and also in the Maharashtra, you can see the KEM Medical College in Mumbai, and in Solapur also it is there, and in AIIMS New Delhi. These are the ones which are available. Okay, so I will leave this. If you want this, PDF as an annotated PDF, please do comment annotate PDF in the comment section. I will leave a link for this PDF in the comments, or I will post it in the Telegram group of Cerebellum Academy official group. Okay, and you can see these were my professors, seniors in my JSS hospital, and you can see Dr. Ashwini madam, she has done her MD and also she has done her fellowship from RGUHS. Okay, and this is my colleague Dr. Ranjan. You can see he has done a fellowship in cosmetic surgery and hair transplantation. So these are some of the additional degrees which you can add on to the MD or DNB afterwards. And these are some of the IADVL observerships. What is IADVL? Is in Indian Academy of Dermatology, Venereology and Leprology. Okay, this is an association of all the dermatologists, and in this there are various observerships which you can join. These are all the observerships. I will just scroll through all this which are available. And of course, like I have told you, the procedural dermatology is also very vast. It is available as a a course in the form of the book. Okay, you can buy the book and you can read, in which all the procedures are going to be covered. Like for example, vitiligo surgeries, the derma rollers, and the threads, the botox, all these are going to be covered in this particular book, AXI. Okay. And related to the books which you have to follow in your residency, I have made a video, so you can check that out in my channel. Just type the derma residency books and followed by DRMSD, so you are going to get the video in my YouTube channel, Dr. Maddineni Srinivas Dermatologist channel. And so with this you can understand that the dermatology, the scope of dermatology is very vast, and also the future is very very bright. Okay, so these are the things which you can understand from this. So you might be also next thinking about the money, vitamin M. So if you are thinking that after you step out of the college where you have done the MD, DNB, and immediately afterwards you are going to be absorbed into some corporate setup or medical colleges, and they are going to pour money on your head, so you are mistaken. So remember students, the journey after you finish the post graduation is also going to be little dicey, depending upon where you want to practice and how much money you have already with you. So are you going to be affordable with the instruments, or it is very difficult, you want to join corporate. So depending upon that, I have made some differentiating pointers related to each of this, but whatever it is, during the counseling, remember students, your main criteria should never be only money. Earning money should not be your only criteria. Yes, that is also important, but what is more important, you have to follow the passion which you have, the subject which you love. That is the most important thing which you have to think of. I have seen many students who took radiology, and they feel very bad because they don't have the patient interaction, which they like much, like a lot. So you are just like some machine. Okay, you are just a part of a machine who is just diagnosing the condition in a patient. Okay, yeah, if you liked radiology, if you like the detective like work, then fine, you can take that, but don't think of money. Yes, radiology has very good money. Let me tell you, even after stepping out, after getting the MD DNB, I have seen many individuals, okay, who are getting 1 2 lakhs of rupees by doing freelancing. Okay, they will roam around different hospitals, different diagnostic centers. Okay, morning in one diagnostic center, afternoon one diagnostic center, and evening one hospital. Okay, they will be attached, and from each place, if they are getting 50,000, they will get 1,50,000 in a month. So I know the individuals who are doing this also. It's very much possible in other branches, but in dermatology, this specific thing related to money might not be possible. But whatever it is, follow the passion. That is very much important. And recently only I have got this query, so that's why I have elaborately told about this. Okay, can I get at least 1 lakh of salary? So we cannot guarantee the amount, because it depends upon where you want to practice. Okay, whether you want to practice in a town where there the population, so much of population which you can cater to, or you are going to a village where the population might be very less, and who might not be very much interested in the dermatology related problems. In villages, usually they go to the pharmacy, or maybe they will apply something which is available in the home, and home remedies may be tried. So depending upon where what is your the location, where what is the topography in which you belong to, the salary might be different, the timings might also be different. Okay, so we cannot give a proper thing, but I will try to tell which place, what is the scenario. And the final goal of all the doctors is to help the patients. Okay, whatever it is, 19 subjects are great, don't think one subject is less, one subject is more. Okay, yeah, this is what is important. Yeah, helping the patients is what is our ultimate goal. A person may be anatomist, Shrikant sir, okay, teaches wonderfully, and imprints the books in the brains of the students. That is a great thing. Okay, so you may be any belonging to any subject, you may opt any subject. Don't think that it is inferior to anything or superior to something. Okay, it's nothing like that. And just see Gobindra Garg sir, Vivek Jain sir, awesome, isn't it? So you have to be passionate. If you are having that passion, you are going to do wonders in the branch. Okay, you are not going to get something from the branch, okay, you can also give something to the branch, and with the help of that both branch and you can become famous and also earn money with that. Now coming to the dermatology proper. So yes, the first thing which you can think of is start the own clinic or private practice, which we call it as. So for this, what is required, the one room for the OPD purposes, one small chair for you and one small chair for the patient, and a magnifying lens, a torch light. Okay, this is all that is required, and information knowledge in the brain, that is what is required. Not much of investment is needed for practicing the core or clinical dermatology. But if you think of aesthetic dermatology, cosmetic dermatology, okay, that is not mandatory. You can also practice along with the core dermatology, but if for that you need some investment, okay, like for example, you have to buy some chemical peels, okay, PRP, platelet rich plasma, and you may also think of renting the equipment, the laser equipment nowadays can be rented, and you can pay the rent every month, or depending upon how many patient sittings you are doing for a particular patient, okay. Slowly you can, with the help of the core dermatology, build the clientele, okay, build the patients, and slowly buy lasers yourself. You may be in a position to buy the lasers after few years, okay, and also sophisticated equipment after many years of the private practice. This can be done, or also you can think of, if you are okay, take a loan and you can buy the equipment, lasers, and you can pay the EMS. But I would suggest initial years for practice core dermatology, slowly build the confidence of the patients. By the word of the mouth, more and more individuals, patients, clients will come to you. Then you can slowly think of increasing whatever business. This is a business only, private practice. So increasing the business, you can think of that later on. But if you wish to have a fixed salary, then you can have options like joining the medical colleges, where like you can join as a senior resident initially, and slowly you are going to get promoted into assistant professor, associate professor, okay, and professor. So that is the hierarchy, and the initial salary might be from a range of 50,000, 40,000 also may be the salary some areas, okay, 40 to 90 to 1 lakh to 1.2 lakhs also might be there. So don't compare the salary, because it depends upon the cost of living. For example, in Delhi, if we get 1 lakh, that might not be a lot, because we have to pay rent, which is exuberant. So much of rent in Delhi, it is almost 25 to 30,000 if you have to get a good house. But in the case of the south, the rent is not so much. So if you get even 70,000, it might be enough. So depending upon the cost of living, salary might be different, okay. And also you might think of the offers in the Middle East, okay, abroad, okay. In this video I'm not going to discuss about this particular Middle East stuff, abroad stuff, okay. If you want me to make a video on that, please put in the comment section abroad, derma abroad, okay. And yes, if you wish to have more money, you can go to peripherals and villages, and there will be some camps happening sometimes, where you can join that and you can see many patients, and you are going to get some amount, okay. Weekends you can do that. With the help of this, money and exposure also is going to be obtained. That is a good part. Coming to the corporate setup, now this is very dicey. So whenever you join any corporate setup, like for example any corporate hospital, why should I take the names? So if you join there, what you are going to get, the pay is going to be not fixed, but it might be like how many patients you have seen, how many hours you are there in the hospital, like that, okay. Slowly if the clientele increases, then maybe they may also give you the fixed salary, but initially it is going to be based on the incentives or the number of patients who we are seeing in a given particular day. But if you are not having any money issues, so vitamin M is surplus, then you have so many options, okay. First option maybe like you may take some time and do fellowships in the India if the money is not the problem, Okay, and also you can do it in other countries also, except for the United States and UK. In other countries, the fellowships can be done, and you can come back return, and you can write down the suffix, the particular fellowship which you have done from where you have done. Okay, and also of course the lasers and hair transplant setup, there are so many fellowships in this particular thing. There will be so many FAQs, frequently asked questions, which many students ask me. The first one is, sir, in dermatology, the patients, they want beauty, so will they expect that the treating dermatologists also should be beautiful? So I would say everyone cannot be like a hero heroine. If I was a hero, then I would have gone to Tollywood. I like movies a lot, but it is not the case. In the dermatology, anyone can practice, it's not a problem, it's just a myth. Okay, beauty lies in the eyes of the beholder. If you're having androgenetic alopecia, if you're having acne scars, it's okay, that's understood that once the stage crosses, once the androgenetic alopecia stage goes into the stage where only hair transplantation is the solution, then what can anyone do? Yeah, if you are very much interested in dermatology, you can join dermatology, get all these treatments free of cost in your institute. You can get, like, for example, PRP, the derma roller, and also hair transplantation, if you are lucky enough to join in an institute where there is fellowship in hair transplantation. So whatever it is, if you like the subject, if even if you are like looking like Jeff Bezos, nobody cares. Okay, so these are all myths. If you are having passion, do join this. Do not worry much about all these things. If you are really worried, get the treatment done. What is there? Anyhow, that is they going to be available in the institute itself. Now coming to the most important thing, sir, how to select the medical colleges. So this is very important. So whenever you have to select the medical college in which you have to do the degree, so always look for some of the important things. Like for example, you have to look for whether the OPD is having good patient load, at least 200, 300. At least are you getting some 50 to 100 patients in a given day, so that you are going to get the good exposure of common skin diseases and uncommon presentations of common skin disease, and also common presentations of some uncommon skin disease. So these are all the things which you have to think of, and not only just the OPD patient load, you should also look for the academics. Why are academics important? So remember students, just like I have told you, the books of dermatology are very bulky. So in this subject, there is a lot to learn, which is very difficult for you to learn alone by reading the books. Okay, so this is going to be taken care of by the academics, where journal, case presentations, okay, and also lectures are going to be happening. So with the help of all these mixture of academic activities, and also of course the ward rounds, all these are going to help you to learn dermatology in the 3 years span. So the hospital, JSS Hospital, it was a private hospital deemed to be university. Being a private hospital, still it was having a great patient load. The reason was because the patients were actually paying very meager amount. Why? Because the hospital was taking hefty amounts from the PGs who were joining. So that was the reason why patients were having a very little amount to pay to the hospital. So select such hospitals. Manipal Hospital, it has a brand value. It has a good name, and the academic activity and the patient load, and also the equipment, everything is great in the such Manipal Hospital. Okay, so like this, there are so many private hospitals which are even more better when compared to government hospitals, which you can happily opt. So like I have told you, whenever you want to join a medical college, always look for the good vibes. So what do you mean by good vibes? So check whether the faculty who are there are having any toxic past. So that is there is a PDF, I hope you might be knowing, which is circulating, which is giving various medical colleges and the departments which are toxic in the sense they are extempore, very extreme, where there is like for example unfortunate situation which happened in the Kolkata. I hope you might be knowing that. So like this, there might be some departments which are very extreme, so avoid them. Always choose the department, dermatology department, which is having good words with good faculty. And I can tell you this quote is very much correct. Good teachers are the reason why the ordinary students dream to do extraordinary things. I was a below average student, but because of my great mentors, I am in front of you. Thanks to all mentors, and try to opt for these kind of colleges, okay, colleges, hospitals which are having good faculty who are interested in academics. They are the ones who are going to make you great. Remember my words, after you complete the course you will remember my words then, okay. And also some research activity if it is there, like for example some publications, that is also add on. And like I have told you, in a good college there is going to be this ward rounds, and also there is going to be these teaching programs where journal clubs, case presentations, everything will be happening. Of course there is also going to be a lunch along with the case presentation. And yeah, journals, you have so many of the journals in dermatology. These are all the journals from which some topics may be selected and you need to present them, okay. And so there are so many other queries also, like for example, sir, how to go about dermatology? It is so much vast. So there's dermatosurgery, dermatopathology. So students get confused with all these things. But remember, the most important of all this is clinical dermatology. Like I have already told you, the information, the knowledge in the brain is the most important thing. Patient is going to come. You need a magnifying lens to observe the patient, some light, a room, chairs, table, that's all. Nothing much is needed for practicing clinical or core dermatology. And at the most you might require a dermatoscope, that which is a costly magnifying lens, okay. But yeah, if you want to practice surgery, there are options. If you are interested, you can go into that branch also. There are chemical peels, aesthetic dermatology, so many chemical peels, hair transplantation is there. So these are all the options which are available, which you can opt for. This you can see this is a one of the important equipment which is available in the JSS hospital. Just when I was coming out of the hospital, this new equipment was added to the department. So you have to check this most important thing, whether the equipment, the lasers which are prescribed by the NMC, whether they are available or not. Basic things like for example phototherapy unit, the lasers which are hair removal, tattoo, the pigment removal, and also the carbon dioxide laser. So these are some of the basic things which have to be there, and also the RFC and also quackery. If these are not available, okay, quackery, RFC, phototherapy, if they are not available, then it is red flag. If lasers are not available, it's okay, you can do your PG, and you after coming out you can while doing SRship, do in a good medical college where the lasers are available, and you can practice and you can learn from there. But if quackery and phototherapy are not available, it is very difficult. So you can see these are my colleagues who have started their own practice in Bangalore. So many of them are there. So these are some of their clinics, and this is one more my colleague Dr. Vinay, and again this is another Vinay. So you can depending upon what you want to do, you can make the setup of core dermatology or the combination of core dermatology along with aesthetic and cosmetic dermatology. It is nothing that you have to do aesthetic, you have to do cosmetic surgery, nothing like that. You can practice core dermatology also along with few aesthetic and the surgical things mixed with the core dermatology. Now coming to the most important doubt which many students have, sir, diploma, DNB, MD. So I will try to answer those queries. So remember students, if you want to open the private practice, own clinic, or for the purposes of job, okay, income is going to be the same for DNB, MDMS. There's going to be not much of difference. Patients don't give a F to what is the degree of the doctor who is seeing that patient. Okay, they don't care about whether they have gold medal in their neck or not. So what the patient wants is whether the doctor is listening to their symptoms with great care, whether they are focused, and whether they are having that sympathy, empathy towards them, and whether they are talking to them. There are some doctors who just listen to what the patient says and okay, use this cream, go. So this is not correct. Okay, the reason why the quacks, okay, let me tell you one reason why quacks are flourishing so much, because quacks, they don't have the subject knowledge, yes, that is there, but they listen to what the patient says very carefully and they reciprocate. Okay, Baba, I understand your problem. So like this they talk and then they write some shit, but still the patient thinks that the quack is very good and he's a god. And once the quack gives some stupid treatment, they use the treatment and they now come to a proper dermatologist and they say you are not treating properly, because we don't have this communication skill. We doctors, we learn so many subjects, but the subject which we miss somehow is the communication skills, the interpersonal skills, how to talk with the other person. So try to gain this knowledge also, how to talk with the patient, how to feel the empathy, how the patient is feeling. So if you have that, so whatever degree you have, whatever medal you have, that does not matter. Whatever institute you come out of, that is also does not much of matter. AIMS, some private college, not much of importance. Okay, and yeah, some medical colleges have different rules for SRship, so you can check that out, the latest teacher eligibility qualification, that will change every time. But if you do DNB from institute which is having 500 beds, above this 500 beds, if you that institute is having the beds, then for all practical purposes the DNB is equal to the MDMS. Okay, and if you are having a state where there is bond, try to avoid, okay, this bonded laborer thing ideally should be removed, but we cannot do anything. So try to avoid all the states which are having this bond. And also many students have this doubt that DNB pass percentage is less. So the pass percentage is improving, and ultimately the pass percentage is going to depend upon how the person, how the student is reading, obviously. So earlier what happened was the DNB seats were given to individuals who did not write any entrance exam per se. They just wanted the admission, and the admission was given into the DNB, and then what happened, they were not reading properly. So that's the reason why the pass percentage previously was very bad. Now it is improving in every subject, not only dermatology. So you can have this details here. And one more thing which I want to tell you is that diploma, about diploma. So in the I think in the MD MS area, the diploma is not available right now. I'm not sure. If you have any clarity, please put in the comments whether the diploma is available or not right now. But as far as I know, I think diplomas are converted into MD. So the hospital, the JSS hospital in which I did diploma, it was converted into a MD seat. Okay, so now coming to the national NBEMS, it is also having the diploma, but unfortunately dermatology is not having any diploma in that. But if you have already done a diploma in dermatology, then there is DNB PDCET, that is post diploma CET entrance exam, which is conducted once in a year, the eligibility for which is diploma in dermatology, and there are very few seats in this DNB PDCET exam. So that is one problem for the diploma holders. So these are some of the list of the examinations. And coming to the Chola Chap, the quacks. So like I have told you, quacks, they have so much of confidence, they have so much of talking skills, communication skills, because of which they give any treatment and the patient feels great about that doctor. But ultimately, yeah, even saloons are doing all this PRP hair transplantation. Yeah, definitely it is going to affect the practice. But remember, students, so there is, I have told you, there is one association of dermatologists, Indian Association of Dermatologists, Venereology and Leprologists. So this IDWell, it is striving a lot to curb this problem, to take out the scourge which is there in the community, that is quackery, and uproot this entire problem from the society. But it will take some time. Definitely it will have some effect, but also remember there will be some patients, okay, who are going to come to us asking for the treatment because they were treated for the tinea which they had with steroids. So I hope you all know tinea incognito they are going to develop, okay, and they will come to the treatment for a dermatologist, proper dermatologist. So whatever it is, ultimately quacks cannot give the proper treatment. So the unfortunate patients, they will ultimately land up into the OPD of a dermatologist only. Do not worry. And also the hair transplantation. If a person getting hair transplantation in a salon or in a dental clinic gets any adverse effect, where do they land up? They will land up into the allopathy only ultimately. Okay. Unfortunately it is happening, but yeah, quackery is going to be removed slowly by the association which is IDWell. And saturation, competition, so many students ask me, students, the saturation is increasing. Yes, the number of the dermatologists are increasing in your area, definitely, but the patients who are having the problems is also increasing. And also if you are seeing a patient very nicely, if your communication is good, if your knowledge is good, if you are able to diagnose a condition well on time, early diagnosis, and if you are giving the treatment, doing the follow-ups nicely, then with the word of the mouth you are going to get a good clientele and you are going to get a good OPD. Do not worry about this competition, saturation. Never anything will become saturated. I have heard this saturation term when I joined, that was way back in 2014-15. So every year this will be heard of, but patient load is also constantly increasing. The conditions, the problems of the patients are also increasing. So nothing much to worry about this saturation and competition part. And depending upon whether you are in a town or whether you are in a city practicing, so yeah, there will be some change in the amount which you can charge from the patient, because depending upon the cost of living. In the village the cost of living will be very less, whereas in a town or in a city the cost of living will be more, so the fees is going to be more. So don't try to compare between the town and city in terms of the salary or money which you are going to get. Yeah, listen to everyone. You are listening to me, and learn from everyone, because nobody knows everything, but everyone knows something. Some point may be given to you by some other video. You might be watching the other video, or you may have watched some other video and you are watching this video right now on YouTube. Whatever it is, have a holistic approach. Watch all the videos and try to get some information regarding the branch, dermatology or any other branch. And the ultimate thing which you have to remember is you are the one which is going to take a beautiful, awesome, great decision which is going to be staying with you, like I have told you, as an invisible life partner. So select the life partner, invisible life partner. You cannot also see that life partner, but yes, it is going to be there till the last breath. Happily you can practice dermatology, nothing much, there is no any surgeries, okay. Happily sit in a chair, see the patient, write the prescription, great, awesome thing. Yeah, everyone is about waiting for the counseling. So some of the previous years list of information data I am putting, some medical colleges, so you can just check it out at what ranks and everything. So you might be well versed with this by this time. And also important thing, college selection. Yes, so if you are from north, so if you are getting good college from south, so if you come to south, then there is a problem with the language. Why this colaveri D? So why this problem? If you are having a possibility of getting a good college in your hometown, try to opt that. What is there? So one equipment is not there in your college, it's okay, fine. But with the patient, you can have a very good interaction, and you can also improve the contacts locally. Always try to opt your hometown. Okay, but if your hometown medical college is worst, it has no patient, nothing, then you can probably think of other options. And like I have told you, avoid the states with bonds. A strict no, even if it is very good. So who knows, if you are joining now thinking that, are okay, bond, I will do it, I will pay the money. Who knows, it might be increased, or they may increase the amount along with the duration of the bond period. And also you might get married and you have to shift to another place. So there are so many problems. So think twice, thrice before opting for a college which has a bond. So if that is the case, then you can opt for DNB also, because DNB does not have any bond. That is one more good thing. And government and private institutions. So in general, government institutes can be preferred because private money is there. But if you have no problem with the money, then like for example Manipal, JSS, other deemed universities where there is good patient load, good equipment, you can opt for the private setup, private hospital. Nothing wrong. So it is not hard and fast rule that government only should be taken, private should not be taken. Okay, I have seen many top rankers who took Manipal even before the other government medical colleges in dermatology. When they are available, they have opted for Manipal wantedly. So depends upon what you want, what you expect, and how much money you can pay. So these are the list of all the medical colleges which were taken in that order of priority by the previous students. Okay, this is not my list. So obviously I cannot go to all these medical colleges and ask how is the faculty and how is the department, how is the equipment. That is humanly not possible. So in this list, so you can see that Delhi, Bombay, these medical colleges are very good. So very good, and they were selected by the top rankers. Please, if you have if you have thought of that taking dermatology is going to be done, definitely, then narrow down your options to which state, and after which you have to narrow down on the medical colleges. And please remember, there are some medical colleges which might be toxic in the Delhi and Bombay also. So try to get the first hand knowledge, call the department and try to ask the PGs. Okay, but don't rely completely upon the PGs because they are also new joinees. Try to get a hands-on information from the third year PGs, at least not first years, third year PGs, or even better if you get some information from the assistant professor, SRs. That would be even more better because they will know the higher level the professor, associate professors very closely. So you will get a good idea because you have to stay for a period of 3 years in that institute. So you have to know whether that institute is toxic or it is cool. Okay, dermatology is a cool branch, man. Why should anyone join in a toxic hospital, toxic branch, particularly dermatology, in that hospital? Avoid all those hospitals wherever there is toxicity in the department. Okay, so I have seen some students joining a branch and leaving that branch because it was toxic. They like that branch also, but unfortunately wrong choice of medical college hospital, they had to leave that seat, and again they were preparing despite getting a good rank. Unfortunate. So avoid this, very very important thing to be avoided. So these are the list. Okay, I will just write down. This was the first priority list. This is the second one. So in that order in which the rankers took the seats. This is not my order. So I will pause it, and yeah, you can pause the video and you can check it out. Yeah, 4. So this is fine. Okay. And now coming to the DNB. So many students will be having DNB, whether to take DNB or not. So Simply put, if you are having a option of the DNB from an institute where there is a good equipment, good academics, good patient load, and you are having a institute where you are getting MD dermatology but not good patient load, not good enough equipment, not much of academics, avoid the government or private hospital, opt for the DNB. Okay, it's okay, DNB degree is equivalent, so just see whether there are 500 beds and above. Okay, 500 or exactly I do not know the number, but if I think 500 only, just check it out. So if the above 500 beds are available, then it is equivalent to MD MS, no problem. But do not opt for a institute only because it is MD MS. Okay, because the academics are very very important. Mark my words, if your institute, even if it is MD MS, if it is not having proper academics, proper patient load, proper equipment, then what will you learn? After coming out after 3 years, you are nothing. So it is very difficult, it will be very difficult for you to relearn from your SRship. So because your SR, you have to treat the patients, so you cannot learn everything. Okay, in SRship, if you have to learn lasers and some procedures, it's okay, but if you are learning the core dermatology, that is not going to happen. Reading in your PG life is going to help you throughout your life. Remember my words, mark my words. Whatever you read in your PG, that is going to stay. That is going to stay for your lifetime. That is a knowledge which you are going to have in your lifetime. Yes, after the PG you are going to learn, no doubt. But the base, the foundation is going to be laid off in your PG, 3 years of the PG. Remember that. After that, you can build even Burj Khalifa also. But if your foundation is not good, very bad, very big problem, very bad, very bad. And like I've told you, if you want information related to dermatology abroad, comment derma abroad. Again, I will reinforce, money is not the primary thing. Primary focus should be only your passion, whatever you like, whatever life you want later on. Okay, don't just think of these 3 years. Later also there is a lot of life. Okay, you might be now thinking, I am energetic, I can do night duties, I can have that adrenaline rush. But later on, after 5-6 years, if you have family, if you have the kids, so much of responsibilities, then you will understand, array yaar, why did I take this branch? It is so much energy draining subject. I should have opted happy cool dermatology subject. That should not happen in the future. So that's why, take the informed decision right now. Have a crystal clear clarity about what you want and what you don't want in the future also, not just now. And one more advice, don't be a goat like this. Okay, once it happened that one goat fell from the mountain and rest of the other goats also followed and fell from the mountain, and all the goats died. So don't have this herd mentality, goat herd mentality. Don't have this. Try to avoid this and be this goat, greatest of all time. Okay, my favorite quote again, नज़दीकी फ़ायदा देखने से पहले दूर का नुकसान सोचना चाहिए. Very very important quote. And like गोविंद राय गर्ग सर says, गोगा सर, potential stream में नहीं बंदे में होता है. So what does this mean is the stream which you are going to take is not going to determine the greatness which you are going to get, but what you have potential, what potential you have to develop that department or that branch is going to decide about your future, the success. Yeah, right now you are everything someone is searching for, the patients are waiting for you in the future. Okay, never settle, do hard work, and all your future patients are waiting for your helping hands. Get ready, take informed decision. And I hope you have enjoyed this video, and if so, please do hit that like button and also share this among your friends, and also of course subscribe to this YouTube channel Cerebellum Academy, and also do comment if you are having any queries related to dermatology, because I can get to know whatever doubts you are having through the comment section. I will be active in the comments and I will try to answer all the doubts of the students. If you have any more new doubts apart from which I have discussed in this video, feel free to put them in the comments. Yeah, any specific topics you want me to discuss related to dermatology, tag me in the comment section and ask whatever doubts or the topics which you want the clarity about. And yeah, these are all my social media platforms, and this is a scanner code. You can scan that and you can join my groups, dermatology groups. Thank you so much for all the patient listening, all the dear students. I wish all this great success for you in the counseling. Select the seat very carefully and do awesome. If you give the branch something, the branch will give you so much more than you ever expect in your life. That is definitely going to happen for sure. So that's it. Happy life post examination, post counseling. All the very best, dear students. May God bless you. Bye bye.